Meniscus is a shock absorber within the joint. It is in the knee joint. It is a semilunar shape cartilage within the joint. Some people call it a cartilage tear, but a meniscus is a shock absorber that adapting the round shape of the femur, which is your thigh bone, to a flat shape of your tibia. This is, if you look at it on the side, it looks like a triangle. Sometimes when we twist, when we turn, the meniscus will tear and will rip that triangle, and this will cause pain. Meniscus tear could be a very severe condition. Patients usually experience a sharp stabbing pain that is very specific to one point of the joint. Not all meniscus repair is possible. Not all meniscus tear can be repaired as well. If a meniscus is torn, depends on the size, the location, it may or may not be able to recover. And at the same time, we will not know the location unless we have an MRI scan. Typically, on a simple small tear on the inside, very, very close to the middle of the joint, usually often does not need repair. However, on the outer side of the meniscus, if the tear is very big, it is advisable to have it repaired. If the meniscus is not repaired, what will happen is that the triangle shape of the meniscus is lost. The function of shock absorbing is no longer possible within the joint, and that will increase loading and increase force within the cartilage and lead to arthritis and cartilage damage. For the appropriate case, it is more important for us to try to repair this meniscus as soon as we can, because it will give the best chance for it to heal. So there are different forms of meniscus repair. Depends on the location, depends on how big the tear is. Traditionally, we repair it surgically with minimally invasive surgery, a keyhole surgery. Some people call it arthroscopy. By going in there, we typically put a stitch through to the meniscus, and these are very clever device. Nowadays, with new technology, we have stitches that will stay all inside without need to tie knot on the outside of the joint. Of course, depends on the severity of the tear and how complicated it is. Sometimes we may have to go what we call a inside out or outside in technique. There are different ways that we can repair that meniscus, and also we can add things into the meniscus now to help regeneration and help the meniscus to repair. There are other ways that we can potentially try to repair the meniscus with injection. However, these are very advanced treatment. It is not suitable for everybody. You may have heard of people try to use platelet-rich plasma, PRP, to try to repair meniscus. I don't think that is possible. There are other things that is possible to be injected into the joint to help to promote the repair of the meniscus, but PRP certainly is not one of them. The important thing is to seek correct advice and have the correct MRI scan to look at the meniscus if you're thinking about repairing. Depends on the location of the tear of the meniscus. Success could vary. If the tear is right on the outside, where we call the peripheral or the red on red zone, it is highly likely to be successful. As you can imagine, there's blood supply in there, so things will heal. If the tear is more to the middle, which we call it the white on white zone, which there's no blood supply, the chance for it to heal is very small. Not all meniscus need to be repaired. There are evidence to suggest that if you leave a meniscus tear not repaired, the patient will not feel it after 2 years. But at the same time, there are evidence to show that if you have a meniscus tear in a certain way, at year 2, you will damage half the cartilage within the joint. So it is very important to seek appropriate advice when we're talking about meniscus tear. Not all meniscus tear is the same. In terms of repair, with the advance of technology, with augmentation, scaffold, growth factors, the chance of meniscus repair to be successful have dramatically increased. Depends on the tear and the location. Typically, the first 6 weeks following meniscus repair is the healing time. It is extremely important for us to focus on healing as well as range of motion. It is a fine balance between too much movement or too little movement that will lead to what we call arthrofibrosis, scar tissue within the joint. Some patients will need to be partially weight bear after the meniscus repair. Some people will not need to be. Some people will be encouraged to put full weight on it to allow the meniscus tear to be stronger, to push the tear into the joint. It really depends on the location and the type of repair. For me, typically, I would give a patient a specialist brace to help them when they weight bear to not overload that meniscus, but allow them good movement and good range of motion. Again, as I talked about it earlier on, physiotherapy is absolutely key following meniscus repair. But typically, we could expect 6 weeks to 3 months of recovery time. So after the healing time of the meniscus, typically take about 6 weeks to 3 months, then it's about physiotherapy, about retraining that muscle. Of course, you can return back to sport or return back to running as soon as you want to. It's a big but for it. If your muscle is not ready, if your body is not conditioned, it's highly likely that you will return the meniscus or have some other injury within the joint. So therefore, I usually typically recommend patients not to return to sport for about 9 months. But that depends on your physiotherapy, depends on your physical condition, and depends on what sport that you want to return to play. It's extremely important to assess this on case-by-case basis.